Hi guys, welcome to Nurse Minute Scoop Memory Tricks in a Heartbeat. Today I'll be talking about tetralogy of FALLOT. This is something that can easily come out on NCLEX and people are having a hard time knowing and memorizing the defect stats included in this heart defect. So, by definition, tetralogy of FALLOT is a combination of heart defects that are present at birth. It causes oxygen-poor blood flow out of the heart and into the rest of the body. So, babies that's born with tetralogy of FALLOT, they have cyanosis. They're very, very blue in color, and that's the medical terminology that you have to know. When people get TET spells, we place them in knee-chest position, and that's one NCLEX question that you don't want to miss. Again, it's knee-chest position for tetralogy of FALLOT. So another thing is, what are the defects that's part of tetralogy of FALLOT? So the way to remember it is, remember the phrase, varied pictures of a wrench. As you can see, the first letter and the last letter of each word, you have to remember those. So it's gonna be varied pictures of a wrench. So these are the 4 defects that's included in tetralogy of FALLOT. So for varied, it's ventricle defect. For pictures, it's pulmonary stenosis. And then of A, it's going to be overriding aorta. And for wrench, it's right hypertrophy. So it's those 4 defects that's included in tetralogy of FALLOT. You don't want to miss this easy question. Just remember that abbreviation. Varied features of a wrench. And that's it. I hope you guys learn from this video. And don't forget the abbreviation to not lose a point during NCLEX. Thank you for watching. Please don't forget to hit like, share, and subscribe, and comment down below for more videos that you want to see. Bye!